Okay, now we're going to go over RICE, which is the easiest and most common way of doing treatment at home for these sorts of injuries. RICE stands for rest, ice, compression, and elevation. So the first thing you should be doing is resting it, which means staying off of it. Second is using ice. Ice is very important. You can do ice in several different ways. I highly recommend just ice in a Ziploc bag, either quart size or gallon size, or you can use a bag of frozen peas or frozen corn because they can conform to the leg. At any pharmacy you can find the reusable bags, but they're a little expensive and sometimes don't get as cold. When applying the ice, some people are a little sensitive to the cold, so in order to avoid any sort of burns, you can use a wet washcloth. Make sure that it's moist in order for it to transfer the cold from the ice to the skin, or you can put a thin layer over it, such as a pillowcase. So you're going to apply the ice directly to the area. I highly recommend that the opening of the bag, it always faces up towards the area that's going to be elevated away, so if it does drip, that it drips straight down instead of straight into the leg. Then you're going to apply a compression to keep that on. The easiest way to do that is with an ACE bandage. You can pick one up anywhere at your local pharmacy, or if you know an athletic trainer, the best thing to do is ask them because they usually have several laying around. So we're going to go ahead and apply from the distal end to the proximal end, which helps push any swelling that may be in the leg or over the injury towards the heart where we want it to return. It should not be too tight. You shouldn't lose any circulation or feel cold in the lower extremities. Of course, you're going to feel cold over where the ice is, but you shouldn't be losing any sort of circulation. Then last but not least, we're going to do elevation. And elevation is best achieved when it's done above the heart. There you go. So lay all the way back and have the extremity elevated above the heart. As far as frequency and duration for icing, you want the ice to be on for at least 20 minutes minimum. There's really no reason to go any longer than that. And then you can remove it for at least 40 minutes in between, or until your skin returns to normal body temperature. As far as frequency, I personally would do it as often as possible, but 3 to 4 times a day is recommended. For treatment, as far as how long you should be doing this for, I should be done for at least the first 72 hours of an injury. If you're not getting any significant improvement during that first 72 hours of your injury, then you need to seek medical attention. As much as you may want to, do not apply heat to the area. That means avoid soaking in the tub, avoid hot tubs, avoid prolong in the shower or saunas, or putting moist heat on the area. This will actually increase the bleeding and increase the swelling, which swelling equals pain. Then after the next 72 hours, if you're starting to see significant improvement later on, then you can add heat to your treatment. I hope that you have found this helpful.